Okay, hey, I'm Kayla Whitehead. I'm gonna go ahead and give my report on my patient. Today I had Ella in. She's a 15-year-old female. She was in for head to toe assessment. We She was awake, alert, and oriented times 3. She was very cooperative. She was able to answer questions easily. She had good hygiene. She had good posture. She was able to sit up straight. She walked into the room with no problem. She denied using any kind of assistive devices for ambulation. She was able to walk well. No physical deformities noted. She spoke English as her natural language. She, BMI, her BMI was even to height and weight. She said she was able to get 3 meals a day, had good eating habits. And I think that was it on that. So then we moved on to her head. She had a full head of blonde hair. It was clean. She had good hygiene. Her scalp was clean. There was no issues there. She denied any issues. She denied any tenderness upon palpation of the head. Then we moved down to the face, and the face was symmetric. Her eyes were symmetrical. Her nose was midline. We then checked out the eyes. Her eyebrows, eyelashes, eyelids, they were all clear, good. Her conjunctiva was nice and pink. Sclera clear. Her irises were nice and green. Cornea was intact. Let's see, what else about the eyes? She did not have any drainage noted. Her pupils were equal bilaterally to light. What else about the eyes? I think that was it on the eyes. So then we moved on. We went to the nose. The nose, like I said, was midline. It was clear. It was open. She could breathe easily. I did not notice any lesions, any drainage. Her septum was midline. No deviation there. We then went to the mouth. Her lips were nice and pink. There was no cracking, no dryness there. Teeth and gums were nice and clean. We checked the hard and soft palate, tongue, buccal mucosa, back of the throat. Everything was nice and pink. There was no redness noted, no exudate noted upon my assessment. Let's see. I think that was it on the mouth. We also checked the ears. The ears had no tenderness upon inspection, upon palpation. She had no drainage noted, no hearing difficulties. All cranial nerves 1 through 12 were intact. We tested all of them and they were intact. We also then went to, then we moved on. We moved to the neck. Her trachea was midline. All lymph nodes were palpated. She did not have any, I did not notice any swollen lymph nodes, no tenderness upon palpation. Let me think. We checked carotid on each side. There was no, and we also auscultated carotids. There was no bruise heard there. Then we moved on down to her heart, S1, S2, no S3, S4 noted. Her rhythm was regular. We also listened to the aortic, pulmonic, Erb's point, tricuspid mitral valves. They were all even with regular rate and rhythm. No thrills noted there. Then we went on, we listened to her, we checked her lungs, posterior and anterior thorax. Neither, she did not have any tenderness there. Upon auscultation, her lungs were clear to auscultation bilaterally in all lobes. She was not using any accessory muscles to breathe. Her respiratory rate seemed to be pretty even. She was not having any difficulty breathing. We also checked for her thyroid. I was not able to palpate the thyroid. She had no tenderness there. And then we, the heart, the lungs, then we moved on to her abdomen. Her abdomen appeared to be nice and flat. The skin was warm and dry. It was intact. There was no striae noted. No masses, lumps, no kind of lesions or scars or anything noted on the skin there. Upon auscultation, bowel sounds were heard through all 4 quadrants. She, bowels sounds were presented that, upon percussion, tympani was heard, and upon palpation, she had no tenderness, in any quadrant. She, we did light and deep palpation. She did not have any trouble there. When assessing, I did not notice any kind of pulsations or peristalsis. None of that was noted. Then we moved on to her lower extremities. Her lower extremities, the skin was intact. There was no, like I said, no bumps, lesions, no scars or anything there. Skin was warm and dry. Hair distribution was good. Her lower extremities appeared to be straight and symmetrical. She had good range of motion. She had good muscle strength in both lower extremities. She, what else? Good range of motion. She, her lower extremity pulses were good and strong. We checked the patellar reflex and it was positive, and then we moved on to the upper extremities, which I actually forgot to do in my assessment. I'm sorry about that. We, I'm just gonna say, I guess that she had good range of motion, good muscle strength there. She was also negative for the scoliosis test. And I think that was it. I hope I got everything. Have a good day.